Hello, everyone. So, I am Dr. Ramyasree, your Afghan guru. So, today I welcome Durgeshwari. She has got rank 39 in INI-CET. So, I congratulate her. It's a wonderful rank. And so, how are you feeling, Durgeshwari? I think
Ma'am, honestly, it's the feeling hasn't sunk in yet, and I'm on cloud nine.
100%. So it's
Yeah,
not easy to get there where you have got. It's a dream of lakhs of students. So it's something which is marvelous actually, right?
thank
So
you, ma'am.
that's wonderful, wonderful what you have done. I think your parents also would have been super proud.
Yes, ma'am, they were very, very, very happy.
So this one moment is like something so precious for everyone, right? And
Yes,
we
ma'am.
all dream. So did you ever dream of this, people taking your interview, you coming to this
As
rank?
I, I think everybody dreams about it somehow. Somehow they'll be interviewed and they'll get a very good rank. Like I also dreamed, but it was a dream. I never thought it would actually come true or something.
Right. So, you're from which college?
Ma'am, King George's Medical University, Lucknow.
Wow, nice. So KGMU is also a very good college, actually, right? So, uh, what kind of a student you were during your MBBS days?
Ma'am, I'd say I was a good student. I used to study and like I got good marks.
So you're a studious student. So when did you
Yeah.
start your preparation?
Actually, I got a subscription during the end of my second year, which I started using since third year. So during third and fourth year, I just tried to complete the subjects and
Hmm.
solved some MCQs, like not per se targeting NEET or anything. Just gave my
Hmm. Hmm.
profs, and I started seriously during my internship only.
Okay. So this was your first attempt?
Yes, ma'am.
Wow, yeah, superb. So you directly cracked it from internship. That's
Yes, ma'am.
wonderful. No, that we always see that only that during internship, but you have started studying from second. Most of the toppers have this habit that they've started from second year and after finishing their subjects, they have done the MCQs. So that's very positive. Now, how did you handle your internship along with this, preparation for the NEET?
Ma'am, actually, the hectic subject, surgery and medicine, they were the first ones that I completed during internship. So
Okay.
during that time, I think I didn't get much time, but I tried to make use of whatever time I have. And then there were light postings, so I it was easy to get time during those postings. So that was like that.
So you
And
try to
some days,
utilize your lighter postings so that you can
yes, ma'am.
utilize maximum time on that.
Yes, ma'am.
Right. So what were the subjects which were very tough or difficult for you?
Ma'am, honestly, pharma, I found it very tough, and
Yes,
biochemistry, ma'am, it's very volatile and it's very hard to remember.
I agree with you. Even I felt nightmare for both those subjects. Biochem
Yes,
is very volatile. Pharma
yes,
is
ma'am.
also, there's a lot to remember actually. So basically the first, the second year subjects, but the final year subjects, I think it's easy for us to master because we are seeing those patients,
Yes,
right?
ma'am.
So, what is the advice you want to give for your friends? Like, how they should concentrate and which subjects they should make it strong to get a good score.
Ma'am, I'd be speaking for INI-CET, like the trend focus on first and second year subjects more.
Hmm.
Topics, if they master, then they can like apply the concepts better, I think. And because the questions are integrated, they always integrate first and second year topics with the final year subjects. So I think if the core is strong, then you can crack the questions easy.
So, this is one important point. You should always make the first and second year basic subjects very strong. But we just sink in like we have just entered, but we don't, but they definitely have to be strong in order to understand the other subjects. That's 100%. Anatomy forms basics for so much, and uh, patho, everything is very important,
Yes.
right? So, how did
Yes.
DBMCI help you in this entire course?
Ma'am, actually, I had opted for test and discussion series. So I feel during test and discussion, some minor points that like we don't realize these are important, or per se we don't read them because we don't have time. We don't have that much time. So I think during the test and discussion we get to know those points specifically, and because the teachers are so good, like all the points and the
Yeah.
concise notes also, all of
So
these
you will
points.
understand how to apply whatever you have read through the questions.
Yes, ma'am.
Right. That's wonderful. And so, what are you planning to take, or what are your future plans now that you have reached here?
Ma'am, I'm planning to take general surgery.
Okay, I've been waiting from so long to somebody to tell that I'm planning to take Obgyn. So till now, whomever I have interviewed, no, not even a single person has told they want to pick up Obgyn. But general surgery is also definitely a very good branch, right? So definitely you'll get general surgery also. You're gonna rock doing so good surgeries. So
Thank you, ma'am.
I think you can while you're picking up the general surgery, you can concentrate more on laparoscopy, robotics, because that's the future. It's so much fun and
Yes,
all
ma'am.
that, right? Okay, now
Yes,
what
ma'am.
is your like there's so much stress involved in this during this preparation period, and you could crack it along with the internship. How did you handle this stress? Like exam se pehle, there are so many negative thoughts coming कि भाई मेरा मुझे याद रहेगा. So one question all every students को strike कि what I'm reading मुझे याद रहेगा नहीं याद रहेगा. Were you getting all such doubts?
Oh, yeah, of course, ma'am. This happens with everyone who's preparing for such competitive exam, like so limited number of seats and so much aspirants who are like applying for the exam. So I think my family and my friends, they played a great role in supporting me and then keeping me positive throughout. Especially my mother, she always used to say कि हो जाएगा, इतना मत सोचो. You just do your best and the rest will fall in place. That is
That's
the
true.
thing. And there are always days when you think that some GT score it's really bad, and then you think you can't do it, but you just have to push through it because it's just a GT score. It's not the final
Hmm.
score. You have to understand that.
Correct. Many people actually just go down by seeing their score, and that demotivates them, and they're not doing further. I think we should not, we are practicing GTs so that we can do well in our exam. We have to learn through GTs, then taking the score too serious, right? So,
Yes, ma'am.
how frequently would you give GT?
Ma'am, initially, like I started during July, so at that time I did not complete my first reading. So then I would give like 15-20 days interval, and then weekly I like just the duration increased.
Hmm. So, on an average, were you doing weekly one GT?
Yes, ma'am. Sometimes 15 days, depending on what posting I was doing at that
Okay,
time.
okay, right. So ideally is to do at least once in week or once in 2 weeks, but giving
Yes,
GTs
ma'am.
is very important, right? So any other advice which you want to give all your friends, like, because now so INI-CET, you have all shined, but there are certain students who are still preparing for the NEET. So what is the advice you want to give all of them?
Ma'am, I would just like to say this is just one exam. Like you have so much to
Yes,
look forward to. You can't just
yes.
lose all your hope and think that I have done such bad, so I must like there must be some fault that lies with me. So
Hmm.
it's just one exam. Maybe it was not your day. Maybe like your mental state was not that good. So you just keep on going.
That's 100% correct. I 100% agree with you, Durgeshwari. So, it's very important for us to keep going on, and probably it is for our best. Universe
Yes,
always
ma'am.
have best plans for us. If this not didn't work, there's something more better to come. So, only thing what all others can concentrate is not about thinking the INI-CET results, but as you have done, hard work definitely pays off. So, if they can consistently read for this next 28 days I think are left, so they
Yes,
can
ma'am.
also rock like you. So you enjoy party now.
There's so much free time. I don't even know what to do with it. It's like I was
Yeah.
studying, 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 and suddenly my whole day is just I'm just sitting there and thinking what to do.
So you have got so much habituated to study, you're not feeling empty. Yeah, this is
Yes.
definitely true. We actually feel this period, what is going on, is like such a havoc. But actually, once we finish it, we don't know what to do. I keep telling, like, if they're working this 28 days, next 6 months is a holiday period. By the time you actually
Yeah.
get the seat and join and
Yeah.
all, right? So I
Yes,
think
ma'am.
this, you have worked all through your life for this day. So, today, the day which actually we all keep working in our, so, you have to get that energy for, again, for the 3 years, the grill which you're going to go through.
That
So
that is that requires a lot of patience, those 3 years.
yes. So, but that also is another fun, every moment of our life is so much fun. Like all these are
Yeah.
new experiences what we go through. So I am so proud of you, Durgeshwari, and all the best. Hope you become more, like, many more success to you, super specialization, robotics,
Thank you,
everything,
ma'am.
every dream you dream, let it happen. So all the best. Thank you so much.
Thank you so much, ma'am.
Uh,
Because
hmm.
they are the OGs, medicine and an ad. So I did those.
Yes. So wonderful, yeah. So keep enjoying this success. This is like so this 6 months, enjoy whatever you want to do so that you'll get full regenerated to
Join my
या
residency.
या सो आपको जो करना है अभी कर लो, मतलब जो एंजॉय करना है, ताकि आप फिर जाओगे फिर नहीं लगना चाहिए कि हमको ब्रेक नहीं मिल रहा है।
There are no breaks in residency.
या इसीलिए बोल रही हूँ, अभी कर लो जो करना है, ट्रिप करना है, जो करना है अभी कर लो, फुल रिजुवेनेट होके जाने के लिए। आई कन्वे माय कांग्रेचुलेशन टू योर पेरेंट्स आल्सो या।
Thank you, ma'am.
या थैंक यू सो मच, चलो
Thank
बाय।
you. Bye, ma'am.